now we're going to talk about case conceptualization. You will use this case conceptualization form. I always tongue twist with that word, but you will use this form when you are describing your cases and talking through your cases in our supervision, okay? Supervision takes place with a group of the other staff, other colleagues, and together we will talk through and sort through the challenges and successes that you may be having with your cases. So take a look at this document and we'll work through it together. Here you see the case conceptualization form. And at the top of it, you see name of presenter. That's going to be your name. You will also put the date that you are submitting this form. Now, if we're talking through the same case that you may have, this date may need to change depending on when you are presenting and when you've last seen the client. That may be a tricky one. If you have questions about that, please let us know. Number 1, we see the client demographics. You see here in parentheses, we're talking about their gender, their age, their race, their ethnicity, their relationship status, their age, their children occupation. I said age twice, but their occupation, their employment status, all of those things. List them here on section number 1. And you can literally list them just as you see here with commas that would separate them. Number 2 is their presenting problem. Again, you can literally copy and paste this right from the referral that we sent you in your email to talk through what this client is interested in receiving therapy services for. Number 3, we will list your session number. And so in the session number, please let us know what session this is that you are seeing them. Is this the first time you're seeing them, second time, third time, and so on. A short summary of this session is number 4. Tell us what you did in this session, particularly what was the session about. You may be able to copy and paste this section right from your case notes. So that may be an interesting place that you can insert that in here. The tentative assessment or problem or diagnosis that you may have. Again, as a marriage and family therapist, we are using our DSM-5, and so that is no exception here. I want you to really think through what your assessment will be of this client and making sure that it fits all of the parameters for the tentative diagnosis that you will give the client that you see. And you will list that here. Together in supervision, we will talk through what it looks like, what it actually is, and we will support you in making this assessment here. However, the initial steps are up to you. Also, in section 6, you see here, we're talking about goals. And so I want to hear in this section what your main goals are and what your sub goals are. Stay tuned for another video on how to do a treatment plan. We will talk about how to list goals. But for now, this section is specifically dedicated to you just bullet pointing to us what your main goals and your sub goals are. Okay, so in number 7 here, our main goal is looking at how you will address the goals in the session. And so on number 7, you're taking one of your sub goals and you're telling us what exactly did you do? How did you address it? Number 7 and number 9 kind of work together where you're saying, what will I do and how will I do it? With number 8, what we are looking for here is what theory will inform your work. So if you're using Bowenian theory, please tell us. Please tell us specifically what theory you will be utilizing to inform how you will treat and care for this client. Number 9, with that theory in mind, please tell us what interventions will you be utilizing with this particular client. So if you're using Bowenian theory, if you're using narrative therapy, tell us how will you use these particular theories, what interventions, what practices, how will you make this theory come to life in your session, okay? And then number 10, we're looking at your struggles with the case. This may be any types of struggles, whether it's self of the therapist work that maybe you need to do, things that are coming up for you in this session as you process, maybe clinical issues, maybe ethical issues, anything that could be happening in this case that you're saying, I'm not really sure how to deal with this. Please list it here so that as we go through this case and as we talk through cases, it's easier for us to attune to what you may need, okay? And then number 11 are ethical concerns. This is the same thing. Ethical concerns that are related to this particular case. Please let us know that. And then finally, number 12, the plan for the next session. How will you take the feedback that you were given previously, and how will you apply it to what you are going to be doing for the next session? This may be updated after the case conceptualization meeting, after we talk through it. However, we would like to know just simply here, based off of what you previously did, what might you be planning to do for the next session? Let us know that. This form will be submitted every single time that you have supervision. You will use it for one of your cases to talk through how you will present your case, okay? So make sure that you complete this every single time before we meet for supervision, as you will be using this weekly to hone your skills in talking through your cases and getting proficient in that, okay? Again, if you have any questions about this or any of the material that we've presented to you, please let us know at restorenyquestions@gmail.com.